So, in a reflection for my clinical goals for this semester, which my goals were being able to improve my skills when it comes for the ankle taping while doing the heel locks. One of the goals that I also had was better, better have skills for the palpations in order to recognize the ligaments. But then I received a feedback rather that could be for later semester, not for this semester. So I decided to switch it up for a goal that it will be better when it comes to an evaluation, being able to do a proper eval on the patient, know the process correctly, and being able to do the muscle tests and like the special tests properly in order so I can be able to diagnose and be more in depth of the injury that has the patient. And my other goal was improve the taping skill for my wrist. Um, the way that I've been implementing these steps, it will be more every time that I've been going to clinical. There usually is more for practice for football, and usually the games for Friday for football. I've been asking whenever a bunch of patients come in, a bunch of high school students and stuff. They wanted to get their ankle tape or something, and since my preceptor is the only one there, so that way I can be able to help her out, I'm being just willingly encouraging myself, asking the patients like, hey, what do you need? Do you need something? You need some ankle taping? You need some wrist taping? What do you need that I can help you out in order so I can be able to help also my preceptor? Um, that's the way that I've been trying to be able to improve my skills, being able to for my tapings and for the ankle and the wrist and all that stuff. Um, the way that I need to maintain for to change or ensure the achieve of my goal will be keep encouraging myself, like be able to keep asking the patients, what do you need? Do you need something? Not only just wait for them to come to me or just wait for my preceptor to let them know to come to me. Also encouraging myself, like taking that initiative by being able to go to them and be like, hey, you need something. I can be able to tape your ankle. I can be able to tape your wrist or your thumb, all the tapes that are needed. Or usually when it comes to for an evaluation, we still hasn't properly come yet. When it comes to an evaluation for the patient, usually I'm being just taking like approximately like two evaluations already only. One was for the ankle, and the other one was for the knee, which I really feel really comfortable with them. But obviously, there's a lot of things that I can be able to improve during that evaluation for future evals and all that stuff. Um, the support that I need, actually, the support from my preceptor is being really awesome. It's been really great. Like, she's been there, really open up to me whenever I'm asking her something. She's willing to answer any type of questions. She's willing me to ask me if I needed something when I'm doing some ankle tapings. She's been seeing a little bit also while on the process that I'm doing an ankle taping. Even though she's taking care of some patients, she takes like a couple seconds just to look at some of the procedures, which are the ones that I've been struggling most, which obviously is the heel locks. Every time, not every time, but sometimes whenever I'm doing an ankle taping and I'm in the process of doing the heel locks, she just take a couple seconds to look at it on while I'm doing the process for it, which I really appreciate that support, because like I that way I can be able to improve myself and I can be able to see what I'm doing wrong and all that stuff. The support that I actually need from the faculty will be encouraging me again to be able to keep doing the stuff that I'm doing for now, ankle tapings, wrist tapings, and all that kind of stuff. Just giving me the opportunity so that way I can improve myself in the environment of the clinicals. Um, the feedback that I'm using to improve my skills so that way I can achieve my goals is usually every time that I'm done with an ankle taping, every time that I'm done with any type of like ankle taping or wrist taping, those kind of stuff, I obviously go right away to my preceptor. Even though obviously I'm just waiting for her to get done with the patient that she has. Once her done and once we're all done, I just go to her and I explain to her like how did I feel, what did I feel that I did wrong, and all that kind of stuff, so that way she can give me a feedback on a way that I can be able to improve it. For example, when it comes for the ankle taping, she's usually trying to explain sometimes just a slight different way in order to start for the heel locks, so that way is a way more proper way to be able to do it. Because usually my struggle is that whenever I'm trying to go below the foot, it usually gets a lot of wrinkles in that area, so it's not as like smooth or as tight as it should be. So that's kind of like my biggest problem, my biggest difficult over there. So she always giving me some feedback on a proper way to be able to do it, the way that I feel more comfortable with it, and all that kind of stuff. And the way that I used that feedback that she gave me and the feedback that I feel too is whenever she explains something like that and she explained me to do it a certain way, whenever it comes to the next patient, I just go with them and be like, hey, I'm gonna be doing your ankle taping since you need it, and I'm being just trying to do the same way that she is explaining to me, so that way I can be able to improve myself even more and more for my clinicals and for my future.